It's Breakfast Daily on CCTV. Thank you so much for staying with us. Now, I told you that we're still going to continue our conversation on cervical cancer. I have been joined by Dr. Ayongo Annan and Dr. Sunkwa Mills. They are going to help us really understand the kinds of things we've been discussing all month long, and to also encourage you to tell your sister, to tell your wife, to tell your daughter to get out there and get tested. Okay, last year in Ghana, 3,000 women were diagnosed with cervical cancer, and 2,000 of them died. So it's really, really important that we spread the message. And of course, both of them are part of the Medical Women's Association of Ghana. Good morning.
Good morning.
How are you both?
We are great. Thank you. And you?
I'm good. Dr. Mills, let me start with you. Can you give us a recap of exactly what cervical cancer is and how important it is for all of us to go out there and get tested?
So cervical cancer is an abnormal growth of cells in the cervix, which is the neck of the womb or the uterus. It is caused by the human papilloma virus, which is sexually transmitted. And this virus, the HPV virus, is responsible for about 99.7% of cases of cervical cancer. There are various strains of the HPV virus, the high risk and the low risk. Now, the high risk ones, mainly type 16 and 18, cause about 70% of all cases of cervical cancer. There are risk factors when it comes to cervical cancer. These include the non-modifiable ones, which you cannot do anything about, like being a woman, being African in a low socioeconomic status, and other modifiable ones like lifestyle, early age of sexual intercourse, having multiple sexual partners, or having a partner with multiple sexual partners. I don't know if you can do something about that or not. And also smoking, which is not only smoking directly, but also secondary smoking can predispose you or put you at risk of cervical cancer, and of course, many other cancers.
Okay, so Dr. Annan, I'll ask you about the symptoms, but we're doing something interesting today, okay? Our viewers, we want you to take out a book and a pen, or a paper and a pen, and take notes, because we're going to ask you 10 questions when we're done with the conversation, and the 3 people who get the questions right will receive some really awesome prizes, okay? So grab a paper, grab a pen, make down the notes, because I think Dr. Mills already answered like 4 of the questions. So you will call us in. The number is 0550-585-832. If you're outside Ghana, the country code is +233. And if you're online, just use the hashtag Breakfast Daily. But today you have to take notes, because we are going to ask you some questions and give you some prizes if you win. So, Dr. Annan, please walk us through.
Okay.
Yes.
So mostly it's what we call asymptomatic. There are no symptoms in the early stages, but you may see symptoms getting to the later stages, like bleeding after intercourse, sexual intercourse, pain after intercourse, and then postmenopausal bleeding.
So when you say early stages, how many months, weeks, years will it take for the early stages to
There's no telling, but at least what we know is that between the infection with HPV and frank cervical cancer, about 10 to 30 years.
10 to 30 years,
depending on individual.
So you can live
basis.
to up to 30 years, go through cervical cancer and have no idea that you have it.
Yes. Until the symptoms, the frank symptoms I've mentioned, begin to show.
Wow.
Like the bleeding after sex, pain, vaginal discharge, foul-smelling vaginal discharge, postmenopausal bleeding, and pelvic pain. Just pain within the lower abdominal area.
So you get vaginal discharge when you have yeast infection.
Yes.
Is the cervical cancer discharge any different from the yeast infection discharge? So you can tell differentiate between them.
It's different. The smell, foul smelling, maybe blood stained, and maybe copious, large quantity.
Okay.
Yes.
Wow. And Dr. Mills, please, how do we ensure that even if you have the immunization as a child, you should still go get tested in case you might get it from someone? If you're dating someone who also has multiple partners, can you get it, or once you have the immunization, you're set for life?
So we say that much as the vaccination protects you, after you have had the vaccination, you should still go on and check and get screened every 3 years, like all the other women in the population.
Why though? Because if I get the vaccine for measles, do I have to do it again, or I'm set for life? So why do I have to?
What it is that there are different strains of the human papilloma virus.
Okay.
So we have the notorious ones and then others. And the vaccines don't cover all the strains. So, for instance, the Gardasil covers about 4 strains, and then there's Gardasil 9 that covers 9 strains. But there are many more of them that can predispose you to cervical cancer. So, even though you take these shots, you still need to get screened so that we can catch it early in case you get it. Yes.
Okay.
There are probably over 100 strains of the HPV.
Yes,
yes. 100 strains.
But we are worried about the high risk ones when it comes to cervical cancer. The type 16 and 18. There's also the type 6 and 11 low risk, which usually cause genital warts, and then a whole host of other conditions.
Okay.
So yes, get vaccinated, but have the screening.
Okay. So my next question for you is the tests that you have to get. If, let's say, you didn't get the vaccination as a child, now you're an adult listening to us and you want to get the test.
Yeah.
Walk us through the test. But again, guys, we'll ask you some questions at the end of this conversation, and if you get the answers right, we'll give you some prizes, okay? So the number to call is 0550585832. If you're out of Ghana, the country code is +233. So what are the tests, the different tests that we can take?
So for now, there are 3 main tests that we are taking in this country. There is the visual inspection under acetic acid, or VIA for short. Very simple text. You come in, position yourself, we put a speculum there and check if there are any changes.
Okay.
Then there is a pap smear as well. Most of you have heard about the pap smear. And then there is the HPV testing.
Okay.
So those are the 3 main tests.
Which one is the,
But there's also the co-testing. Co-testing means that you do both the pap smear and the HPV testing.
Why would you need to do 2 tests?
So it's if you're doing the pap smear only, you could do it every 3 years.
Okay.
But if you do both the pap smear and the HPV testing and it's negative, you can repeat it every 5 years.
Okay.
Yeah. So for the HPV test, you are testing for the virus itself.
Okay.
Yeah. But for the pap smear, you are looking at changes in the cervix, cervical area, as well as for the VIA too.
Okay.
Yeah.
Dr. Annan, can you walk us through some of the myths people have around cervical cancer that we can begin to stay away from?
Okay, so one of the things is people think the screening is painful.
Okay.
We've discussed that it's not painful. It's a bit uncomfortable, but it's not different from a pelvic examination or if you have had children. It's even less painful than if you have had children.
Okay.
So that's one of the things. The other thing is the cost. But if you think about the average Ghanaian and how much we spend even on ourselves, and you think about the cost of having to treat cervical cancer, the screening is not expensive at all. And especially this month and this year, all year long, as Lexta has partnered with SynLab, and it's going at a discount from about 100 Ghana cedis to 65 Ghana cedis. Okay. So the price is one of the other issues. The fact that we as people, we always want to see blood or want to see something dangerous before we move. Make it a point that every year, at least you see your gynae. We're talking the last time that we see our gynae only when we are pregnant or there's a problem. But we should make sure that we always at least pass by the gynae, have a chat, and then get examined and get tested for some of these things.
Okay. And in addition to the discounted test by Lexta, Which Hospital is also doing free VIA tests from the 3rd of February to the 28th of February.
Is the VIA the big cotton swab one, or that's a different one?
The one that we put the speculum there and...
Oh,
that's like the visual inspection with acetic acid. So,
so
you put a speculum and then you dab the cervix with vinegar and then you look for changes.
Okay.
Yeah.
And that one is the most affordable one
that's
as
the
well
most
for our viewers in rural
20
areas,
Ghana
right?
cedis.
25
yes.
cedis.
Okay.
Yes.
Okay, so anyone at home actually can just go the hospital again?
Greater Accra Regional Hospital.
Greater Accra Regional Hospital. You can go and get tested for free. Okay, so it's really, really important. They will hold you accountable, Dr. Mills. It's really important. If you're not in Accra, the test costs just like 20, 30 cedis. Okay, so our grandmothers in the village, our nieces, our daughters, we need to get them all tested. Now, the other question...
And there's a self-testing kit.
Yes, I did the self-testing one.
Evalid.
Yes, that one I did, right? So now you can even get tested from the comfort of your home. You don't have to go and have these ladies open you up and stick things in you. If you don't want that, it's not
nice
painful.
And we are gentle, I keep telling you.
Really, it's nothing, okay? And they won't remember once they're done, so it's nothing. But I want to ask, because I threw out some statistics earlier, and you too shared it with me, that over 3,000 women were diagnosed last year and 2,000 of them died. So I want both of you to walk us through exactly what happens when you now begin to see the symptoms at a later stage, and how difficult it is to heal from it and how people end up dying. But again, we are going to quiz you guys this morning, okay? So let us know if you have the answers to the questions we'll be asking you by calling the number 0550-585-832. The number again is 0550-585-832. If you're outside Ghana, the country code is +233. So Dr. Annan, let me start with you. I get that I'm experiencing the symptoms now. I've had cervical cancer now for 15, 20 years. I had no idea. I come to see you and you can't save me. Why?
So what it is that when you come and see us, it's not just blanket, we can't save you, but we'll take a history from you, we'll examine you, and we'll look. So she mentioned earlier that because of the abnormal growth, the cells outgrow their blood supply. They have new vessels forming, some of the cells die, and then these are the things that cause the bleeding. So what we'll do is that we'll have to have a plan for you. We'll have to find out your general state. So we'll do other labs to find your general state. And then based on what we see, it may range from having to take out the womb altogether, radiotherapy, chemotherapy. And we know the psychological aspect too comes in these days, because these days we are looking at patient-centered care. So we look at all those things, and then we treat you one day at a time as we monitor you along.
Dr. Mills, is it like the other cancers that can spread to other parts of my body, or it will just stick to my womb and my uterus and you remove it and I'm fine?
So like other cancers, it can spread to other parts of the body. We have different stages of the cancer. In the early stages, it may be confined to the cervix. In that case, then we can look at just having a local surgery that may remove the womb, and then you will be fine. But at a later stage, when it has spread to other parts of the body, then it means that we have a bigger issue to deal with, because it will spread to the lungs, the liver, like any of the other cancers, and it's quite a big deal at that stage.
Okay, so what are some of the stages that would literally lead to just you dying?
Well, when it goes into your lungs, into other parts of the body, sometimes even the bleeding can lead you to become anemic.
Wow, so you're losing that
so you
much
lose,
blood?
Yes, you lose your blood, and therefore you may need to give you blood, or we'll just sort of do what we call palliative care when there is pain. One thing I've realized too about most of the documentaries you watch, and even the clients that we've seen, is there's a lot of pain in cervical cancer. A lot of pain. The pain can be some of the patients can't even describe what it is. So we sort of do what we call palliative care. We'll take you through pain relief when you need it. If you're having any sleeplessness, we give you something, and it's just about managing you until such a time when.
Where would you feel the pain? Would it be like cramps that you have when you're getting through your period? Where is the pain coming from?
One person, I remember describing it as like an insect or something biting. Like something biting her. That was what she described it as.
Within her
private area.
Wow.
Yes.
Okay.
So these are some of them.
So we asked you guys to call in, and some of you have started, so we'll speak to them and then we'll ask them the questions, see if they get it right. If you get it right, you get a prize. If you don't get it right, at least you learn the answer, and you can now share that knowledge with another woman in your life. So we're waiting to hear the calls, and then we'll ask the first question, which I think everybody should know. So we're going to call into our viewers' number. If you want to also call in, don't forget that the number is 0550-585-832. The number again is 0550-585-832. And if you're outside Ghana, the country code is +233. And as we're waiting for the calls to come in, any last words for women who are watching us who have not gone out to get tested yet?
I think we have made a lot of noise this month, and for your own health, for your own life, get screened. Get your children screened, get your loved ones screened, and get on board to spread the message, like how Lexter has come on board to help us spread the message. women and men alike in corporate bodies should support the campaign so
work.
that the message will go far and wide.
Okay, so we have a caller on the line now. Hello, good morning.
Good morning.
How are you?
I'm fine, then you.
Good. What's your name?
My name is Kumi Kwabena, calling from Kumasi.
Okay, Kumi Kwabena, let me ask you, where can the cervix be found in the body?
Pardon?
Your cervix, where is it located?
The
woman's cervix. Do men actually have cervix?
No.
Okay, the woman's cervix, where is it found in the body?
You can.
Pass it on.
She mentioned it. Dr. Annan mentioned it like 2 minutes ago.
Well, you find it vagina place.
Vaginal place.
Yeah.
Maybe you
Okay.
can take another question.
Okay, I'll take another question. I'll give you another question. Just the doctors are nice. What is cervical cancer?
The cervical cancer is the disease you get from the woman.
What part of the woman's body will the cervical cancer happen?
It's the vagina place, yeah.
The vaginal place. All right, thank you very much. It's okay. We'll get the next question, the next caller. I think he had the idea, but
Yeah, the name,
vaginal
the terminology.
place. So we'll wait for the next caller.
I think people find it challenging to pronounce cervical because I've heard cervical and all kinds of
Okay. Okay.
cervical.
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 Okay, or cervical. Okay. It's not the vaginal place, so that's a very complex area. There's a lot going on. So do we have another caller coming in? Somebody needs to win this gift, guys. So I'm just going to take them all home. Okay, so the number again is 0550-585-832. It's really, really important. Should we tell them the answer?
When we have run through the questions.
Okay, well, let's run through all. Should I run through all?
Yeah, run through the rest for the subsequent callers.
Okay, so I'll go through all the rest of the questions for the sake of you guys. So the first... Oh, I have somebody on the line. Hi.
Hi.
How are you?
Yeah, hello.
Okay, so I'm just going to jump right into the next question. Commonly, cervical cancer has no symptoms in the early stages.
Yes, I'm fine.
True or false?
Hello?
Hi, can you hear me?
Yeah, I
Good
can hear
morning.
you.
How are you?
I'm fine.
Okay, so are you ready to answer the question?
Yes, please.
Commonly, cervical cancer has no symptoms in the early stages. Is that true or false?
Yes, please.
True or false? Is it true that there are no symptoms or false?
That is false.
It's false. There are no symptoms in the early stages of cervical cancer. Okay, let's find out from our doctors if you got it right.
So the treatment is false.
Sorry? You said the statement is false. That means you will have symptoms in the early stages. Right? Okay. Dr. Annan, is it true or false?
This question is true. The answer
Oh, no.
is true. Yeah, because mostly in the early stages, you won't have symptoms.
You won't have symptoms.
Yes.
Okay.
That's why we emphasize on the screening.
So you can go from a year to 30 years without any symptoms.
Any symptoms at all.
Okay.
Yeah.
Okay. We'll want to get more calls in, but thank you so much for calling in. The number again is 0550-585-832. If you're outside Ghana, the country code is +233. Let's get through some more questions. You said I should go through all of them, right? Okay, we have a lady finally. Okay. Good morning. How are you? Okay, I'll ask you, mention 2 symptoms of cervical cancer. Did you hear me?
Good. How are you?
I'm good. Thank you so much for calling in. Now, we just mentioned that in the early stages, you won't get any symptoms. But in the later stages, you might get some symptoms. So can you mention 2 of those symptoms that you might experience in the later stages of cervical cancer? I think the baby wants to answer the question.
Okay. 2 symptoms.
Yes, ma'am.
Yeah, heavy bleeding,
Uh-huh.
and there's a lot of pain.
We have a winner! she took it right out of Dr. Annan's mouth because you
A lot of what?
mentioned.
Pain.
Well, I actually don't know if you're right because we have the doctors in house. So please, let's
She
not.
has to answer more questions.
Okay, what's your name, please?
My name is Avia.
Efia.
Yeah.
Okay, Efia. Doctors, did she get it right or wrong?
Yes, she
Yes, she did.
She did. So
Okay.
next question.
Next question.
Yeah.
All right. Congratulations, Efia. You won. The first woman to call one. Let's get some more callers in. Okay, the next question is mention a screening test for cervical cancer. We've discussed about 4 this morning, so you can mention one for a chance to win a prize. So our next caller, your question is mention a screening test for cervical cancer. And if you want to reach us, the number again is 0550-585-832.
Hello, good morning. I'm Louis Sankwa.
Hi, Louise. How are you?
Good.
Okay. Can you mention a screening test for cervical cancer?
Hello.
Louise, are you there?
Yes, I can hear you. H.
Okay. The number again is +233-550-5832. If you want to ask more questions. But Louise, do you have the answer for the question?
Yes, one of the screening tests is VIA, visual inspection with acetic acid.
Well done.
Well done, Louise. Now we find out from our experts if it's
Correct for 3 points.
nice. Excellent. So we have just, okay, we'll see. Next caller. What is the name of the organism that causes 99.7% of cervical cancer? So our next caller, your question is, what is the name of the organism that causes 99.7% of cervical cancer? Let's see if you can get that question right. Do we have a caller on the line? And of course, if you're home and you want to call us, the number is 0550-585-832. If you're outside Ghana, the country code is +233. We've talked first, we've handled the issue of symptoms, and then the second question we asked had to do with later stages, right? The kinds of symptoms that you experience.
Yeah.
Now, the immunization. What's the age you should get it? Should it only be for girls, or should we get our young boys as well? Dr.
Okay,
Annan.
so from 9 to 45 years, you can get the vaccine. And for the young ones, we say between 9 and 14, we should immunize both boys and girls.
So between 9 and 14.
14 years.
But
We
if we're
immunize
saying
both.
cervical cancer usually manifests in women, why are we immunizing the young boys?
Okay, so we are assuming at that stage they haven't been exposed. And therefore,
Because they are not sexual.
because they are not sexually active at that age.
Okay.
And therefore, they'll be able to be protected from getting or contracting the vaccine when they become, the HPV virus, when they become sexually active.
Okay.
Because they will be transmitting. The transmission can either be from man to woman or woman to man.
So can men get cervical cancer?
No, they can't. But,
But
they
they
can
can
get
pass
the
it.
HPV virus and pass it
to
on
the
to the women.
Okay, so if you're a man,
Yes.
you may not get cervical cancer, but you can get the virus and pass it.
Exactly.
Kofi from East Legon, good morning.
Hello, good morning.
How are you?
I'm doing very well. How about you?
Good. Thank you so much for calling. Did you see the question I asked?
Yes, you asked about the organism that causes cervical.
99% of cervical cancer. What's the answer, please?
The organism is the human papilloma virus.
Okay. Did Kofi get it right?
Yes, he did.
Yes.
Okay. Where does this virus come from?
It is sexually transmitted.
Oh, thank you, Kofi. You won. Congratulations. We'll take one more caller and then we'll continue with the doctors. So for the next caller, should I actually keep giving them the questions before they call, or should they let me call? Okay,
No,
call.
let
The
them
next
call.
caller, call in. Then I'll ask you the question because Kofi got that one too easily. So the last question I have for you is very, very hard. So I'm going to wait till you call in, then I'll ask you the question. And it has to do with the age you can... Yeah, I'm not going to tell you. Anyway.
You almost gave it away.
So please provide some clarity for me. We're saying men can't get cervical cancer, but they can transfer it to a woman. How does that work?
I think you were answering.
Yeah, so the transmission has to do with the human papilloma virus. Like we said, a woman could even have the virus and will not manifest in any stage, in any form. Your immune system can clear it up. Now, when we say it's sexually transmitted, sex between a man and a woman, you remember we said the risk factors, having multiple sexual partners. Mm-hmm. So a man getting the virus, having it, serving as the mode of transmission. Okay. So through sexual intercourse, then you transfer it to the woman. And it can also cause other conditions in men, like penile warts.
Yes.
Anal
cancers, anal cancers.
Yes, anal cancers.
It just won't be cervical.
Because they don't have the cervix. It won't be cervical, but it can cause other, cancers or conditions in men as well.
Thank you very much for that clarity. We have another caller on the line. Good morning.
Good morning.
How are you?
I'm good.
What's your name and where are you calling from?
I'm Nicholas.
Okay, where are you calling from?
I do not know.
Nice. Okay, my question to you is the question that the first gentleman couldn't answer. Where is the cervix located in the body? Please don't say the vaginal area.
It's in the vagina.
Oh!
Like getting deeper in the...
Deeper in the...
He's having an idea.
Okay, let me ask you. What's cervical cancer? Let's try that one.
Vagina. It's like a...
Sorry?
Cervical cancer. An abnormal growth. Abnormal growth of cells.
Mm-hmm.
That is abnormally spread.
Okay. What's the location that it will spread?
Around the cervix.
Okay. And where's the cervix located?
I'm saying the cervix is deeper at the part of the vagina.
Okay. Should we give him some points?
I think we should. Because at least he mentioned there's abnormal growth of cells in the cervix. So that's what cancer, cervical cancer is. Yeah.
But there's a
but
word
the location,
with U
yes.
that they're struggling to...
Yes. Yeah.
Okay.
The neck of the womb or the neck of the uterus, that's where the cervix is.
Okay, so it seems like the doctors are really generous. So we're going to give you the prize, okay? So where are you so we can find you and bring it to you?
Okay, thank you.
Where do you live now? So which region are you calling from?
I'm calling from Aguinaldo.
Okay, so now you know what cervical cancer is. So we hope you tell all the women in your life to go out there and get tested. Thank you so much for calling. Enjoy your day. Okay, so it's the uterus, right? Yes. Why is it so difficult for people? So is it because we don't see it, so we really don't have a name for it, or just the whole...
We do. It's the womb. Awutu.
Yes.
So
that whole space.
Yeah, so it's the neck of it, yeah.
Okay,
or
so
the end of it, yeah.
Yes. So we're not taking any more calls, guys, so we have to continue the conversation. But thank you so much for calling in. And our producers will get in touch with the 3 winners of our little quiz. But the most important thing of all is to contact all the women in your life, okay? Your daughter, your girlfriend, your wife, your mother, your aunties. We all need to go out and get tested. The cheapest form costs about 10 to 20 cedis, okay? So no matter where you find yourself in this country, you can get tested. And there are certain clinics that are actually giving out discounts this month and even screening you for free. Once you know your status, then you can begin to protect yourself against cervical cancer. It's really important, okay? This isn't one of those things where what you don't know won't hurt you. What you don't know would actually kill you. So let's go out there and get tested. Doctor, any last words for us?
I said my last words.
Oh, you said it already. Oh, but you can say it again. Dr. Annan. Dr. Mills is like, listen, I said what I need to say.
So the whole import of this campaign is that we want to emphasize on prevention. Prevention, screening. Get screened. If you haven't done it, get screened. If you have once, it doesn't mean that you are clear. Keep your screening plan and keep on screening. And also vaccination of our teenagers, 9 to 14 years. If we have children in that age group, boys and girls, we can get them vaccinated. And that will help with the long-term prevention of cervical cancer in our nation.
Thank you very much, Dr. Annan and Dr. Mills.
And
you said you gave up your
a shout out to the Medical Women Association of Ghana. They've been doing a marvelous job. Follow them at MWAG_Ghana on Instagram or follow our Facebook page.
And
thank you to Lex.
Yes.
Our sponsors.
Thank you very much to our sponsors. You gave up your last word.
We hope you've enjoyed the show. Make sure you subscribe, like, comment, and share with your friends. This is Breakfast Daily on City TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on City TV.